We showed you how big of an issue mental health and suicide is in our community, and tonight we're digging deeper into services we have to address mental health care.
Yeah, Brittany, and out of everyone I talked to, there is a clear difference since 2020. Not just because of COVID, but because Winnebago County voted to have their tax dollars fund mental health programs. Before that vote, community leaders say our mental health services were business first and did not always meet people where they were.
It limits the availability of services, oftentimes to high volume times of day, and sometimes can kind of limit availability of services on weekends, night times, and also limits the array or types of services that can be provided, often to the most clinical services.
So here's just a snapshot of all the programs that exist in Winnebago County thanks to that sales tax and our mental health board. In all, more than 40 programs get a share of that tax funding. It made $20 million last year. We're going to run you through some of the biggest programs. Now, Rosecrans, they get $3 million to help their services. That includes expanding their current services, cutting wait times, as well as training staff.
And another big program is the Crisis Co-Response Team. That brings together 3 different law enforcement groups with Rosecrans to try and distinguish crimes from mental health episodes, and more importantly, follow up with the people they've seen in crisis days and sometimes weeks after that initial call.
Yeah, and Winnebago County also funds a ton of programs, with millions going to help people at the jail and juvenile detention center. Those programs try to connect people to mental health services during their time at those facilities and minimize the chances of people going back into crisis after they're released.
And then we have smaller programs like the National Alliance on Mental Illness, which you're used to hearing called NAMI. They got $200,000 to help break down barriers and confusion for people who need mental health care.
Yeah, there are so many services outside of the sports funding too. And when it comes to making our resources go the farthest, Danielle Angelari with NAMI says it's all about teamwork, something she thinks our area does very well.
I would say there's a lot of people that have been personally impacted by it that, want to make change. And I think that building bridges between all of the providers, like a lot of people work very well together. Could there be more providers? Yes. But I think that a lot of times people are willing to work together to help people in the community.
We've already introduced you to 2 of those people yesterday. Laura Kane, who runs Marshmallows Hope, and Xavier Whitford, who leads the Tommy Corral Foundation. In the last minute, you've seen just a glimpse of all the services we have, trying to help anyone and everyone who needs mental health care.
Yeah, and despite all of that progress, though, we still have a long ways to go. Here are the places our community still comes up short and how it's impacting people in need right here at home. More people than ever are looking for mental health care. According to Rosecrans, their total patient load is up 20% from 5 years ago. But the biggest jump is outpatient services, which have nearly doubled over that time. That demand is creating a lot of stress on the company, according to their chief medical officer.
There are waiting lists everywhere, across the board.
And it's not a secret why those wait lists continue to grow.
Workforce.
We could use more psychiatrists.
A significant need for staffing.
We need nurses, we need therapists, we need direct care staff, we need doctors.
The problem is putting off mental health care for someone in a mental health crisis has the same life or death consequences as putting off a traditional surgery.
Telling somebody that needs the care and is ready to accept that help that they have to wait 2 or 3 months is not acceptable.
Why is it not acceptable?
Because they're going to either take their life by suicide or they're going to feel that nobody's there to help them. I tried, so why even bother anymore? And they're just going to give up.
The need is so dire that members of the Mental Health Board are thinking they need to shift even more of their focus to the workforce.
That money creates mental health jobs, but if you don't have people to fill the mental health jobs, you're not meeting the needs of the community.
Other issues stem from even finding these services, an issue Rockford Mayor Tom McNamara saw when the city wanted to help domestic violence survivors. He believes the best solution is getting as many of them under one roof as possible.
I don't want to say it's the answer for everything, but we have seen what a best practice is, and it's the Family Peace Center. I mean, a survivor used to have to go to 15 to 20 different locations to get services for them and their children. Now they walk in one building, they do one intake, and they get all of the services.
But even if you put every Rockford service under one roof, experts here at home say there's a service there still wouldn't be enough of.
You like probably at least 2 to 3 times a month I'm getting calls about somebody that needs to get inpatient and they're getting shipped off to Chicago or they're getting shipped off to Wisconsin, and they're like, why is there no place here that can help my child?
That's because there are only 2 choices for inpatient care in the Stateline, Rosecrans and UW Health Swedish American. Rosecrans has seen a bigger demand for adults getting inpatient care because they flipped 40 beds from youth care to adult care this year, a change the CEO says still doesn't do enough.
Our demand for adult services won't be met in full by this addition. We could continue to add beds and meet that demand.
So why is Rosecrans focusing on adults when people say there are so many kids who need care right here in the Stateline? Britt Cotton, who had to send her kid out of state for inpatient care, says it all has to do with insurance.
How many options did you even have in the state of Illinois?
None. As far as residential, we did Rosecrans once, and then the year after that, they no longer took that insurance anymore. So there was one option and then no options after that. So this is completely out of state.
The balance between what services we have here in the Stateline is closely related to what insurance you have.
And tomorrow we continue to dig deeper into the state of mental health and why advocates say the current Medicaid system could cost lives.